So are you new to tongue ties and do you want to know more about what a tongue tie is? Well, then you've come to the right place because in this video we'll go through the basics and the fundamentals of the tongue tie. When you're done watching this video, if you want to learn more about tongue ties, I highly recommend that you check out our other videos about aftercare, bodywork, IPCLC, reattachments, and everything else tongue tie related. My name is Mark Nissen and welcome to tonguetiesupport.com. First off, what is a tongue tie? Well, a tongue tie is the term that's used when the tissue that connects the floor of your mouth to the bottom of your tongue is unusually short or thick, therefore restricting movement of your tongue. If this tissue is so thick that it's restricting the movement of your tongue, you can get it severed. That's called a frenotomy. And in this frenotomy, you basically just sever this tissue connecting the bottom of your tongue to the floor of your mouth, either with scissors or with a laser. In our opinion, it's much better to go with the laser as it creates a much better wound that is much easier to care for afterwards during the aftercare process. Link to a video and an article below that details what aftercare is, because that's really important when treating tongue ties. But how do you actually know if you have a tongue tie? There's quite a few symptoms for tongue ties, both with yourself as a breastfeeding mom, but also for your little one. And for your little one, some of the major symptoms of a tongue tie is the way that he latches onto your breast during feeding. If he's not able to get a latch, or if the latch is unsustained, if he slides off the nipple, then these are signs of a tongue tie. Another sign of a tongue tie is also that he never feels satiated, can't really empty out the breast, so he's always hungry. That's another a telltale sign. For you, it's usually the way that your nipples address the way that he's sucking on them. It could be that they're in pain. It could be that they blanch or that they bleed. That's telltale signs of a tongue tie on you. But it's important to know that these symptoms of tongue ties are not just related to breastfeeding, and it's something that you take with you your entire life. When your child gets a little bit older, the issues with tongue ties change from breastfeeding to speech impairment, for instance. Because if you're not able to move your tongue freely inside your mouth, it's more difficult for you to pronounce sounds, and therefore it will inhibit your speech development. There's a lot of other symptoms too. It could be that your child is experiencing a reflux, or that he's colicky. But I'll link, as I said, to all of those symptoms below, so you know what to look for in the tongue tie. If you think that your child has a tongue tie, and if you want to get this tie treated, I highly recommend that you seek out what's called a preferred provider. And the reason it's called a preferred provider is that there are so many people out there, so many doctors, pediatricians, dentists, that don't know enough about tongue ties. So the guidance and the counseling they give you is either inadequate or incomplete. So it's really important that if you suspect your child of having a tongue tie, that you address one of these preferred providers, which has the actual knowledge required to give you the best consultancy and the best treatment. I'll also link to an article below where you are able to find your own preferred provider, because that's really important for the treatment process. So basically, that's the core essentials about tongue ties and what a tongue tie is. If you want to learn more about tongue ties, be sure to check out our other videos. Be sure to check out the articles we have on tongue-tie-support.com. If you like this video, press the like button. If you want to learn a little more about tongue ties and you want to see more videos like this, press the subscribe button. Thank you very much.